Focus. Ideate. Innovate. Enable.
Transformation has been part of every business's lexicon for years now. In this new world, technology is not a choice, it is a fundamental business strategy that must be interwoven into every part of an organization. In our new 6-part series, Transformation Realized, powered by EY, we bring you stories of business transformation led by India's most inspiring leaders who've created value by placing people at the center of it all and leveraging technology at speed and innovating at scale. In our first episode of the series, we tell you the story of the largest chain of hospitals in Maharashtra while keeping a keen focus on India's healthcare industry.
The Indian healthcare sector is growing rapidly due to increasing coverage, breadth of services, expenditure by public and private players, and the growing demand for good quality healthcare. The advent of the COVID-19 pandemic acted as a transformational catalyst, accelerating the implementation and adoption of changes in public health interventions. The healthcare sector, which was the hardest hit by the novel virus, has experienced massive progress led by digital and technological transformation. In addition to this, the pandemic has given an impetus to the expansion of telemedicine and home healthcare delivery services in the country.
Transformation, a word that has become ubiquitous in the world of business in the post-pandemic world. Leaders today are reframing their businesses by innovating their operating models, even creating new models. They're elevating customer experiences. They're using data and technology to predict the challenges of the future. This week, we're kicking off the Transformation Realized series with Sahyadri Hospitals' transformation journey, its partnership with Everstone, and the impact such partnerships will have on the healthcare industry in India. Joining me now to discuss and deliberate on this further are Abrar Ali Dalal, the CEO at Sahyadri Hospitals, Pancham Mukim, Managing Director at Everstone Capital Advisors, and Kaivan Movdawala at EY India Healthcare Performance Improvement. He's a partner there. Gentlemen, thank you very much for joining in. Pancham, I'll start with you. What's the secret behind Everstone being so bullish about the healthcare industry in India that led you to invest, close to $1.2 billion here?
Yeah, we have been very bullish on the healthcare space in India, focused on businesses that expand access to quality and affordable medical devices, medical products and services. We've deployed close to $1.2 billion across 7 companies, backing 4 investment themes, which are firstly leveraging India's capabilities on R&D and manufacturing, especially in the pharma and nutraceuticals space. Which has been the basis of our investments in Rubicon Research, Slayback Pharma, and OmniActive Nutraceuticals. Secondly, businesses focused on providing quality and affordable medical services to the larger demographic in India, which is where Sahyadri comes into the picture as the largest quaternary care chain in Maharashtra. Thirdly, we've also pursued a buy and build strategy. We've created the largest distributor of pharmaceuticals in the country in Ascent, and we've also created the largest online pharmacy chain in India in PharmEasy. We've also done a buy and build in Southeast Asia, where we bought out multiple businesses in the region, focused on creating the largest platform distributing in vitro diagnostic devices across the region in Everlife. And fourthly, backing a domestic market leader in the medical devices space in Translumina, which has German IP, manufacturing in both India and Europe, and both domestic and global sales footprint.
Okay, if I were to ask you, why did you zero in on Maharashtra specifically?
So we had looked at pretty much all hospital assets across different regions in the country, and a big reason we zeroed in on Maharashtra was driven by the sizable and growing addressable market with 130 million people living in the state, which provided very strong healthcare demand drivers for quality healthcare services. However, the supply was massively constrained in the state. In Mumbai and Pune, the corridor that is, it was particularly more acute, the problem where the demand drivers were very strong, driven by a very high healthcare insurance penetration, almost 2.5 times the rest of the metro markets in the country. A bed density of 0.3 to 0.4 thousand of population versus the national average of almost 1.1. And with national chains contributing only 15% of those beds, the problem was very acute in the region. Within Pune, we found the fastest growing city in Maharashtra, with massive migration coming into the city of Pune, driven by the upcoming SEZs and the IE parks here. And that's where the focus came in on the region.
Okay, so massive demand, and of course, you're fulfilling the supply here required in Maharashtra. Let's keep the focus in Maharashtra. And Abrar, that question is to you. Sahyadri Hospitals has seen quite the journey. Let's begin by, telling our viewers about a bit of a history about Sahyadri.
So I joined Sahyadri in 2020, just before the pandemic broke and just when Everstone invested. Sahyadri started in 1994 with a 50-bedded hospital called Pune Institute of Neurology. And then on, they went on to establish their first major hospital called Deccan Gymkhana in Pune, which was 165 beds at that point of time. Then on, they built 8 hospitals. So currently, Sahyadri exists in a hub and spoke kind of a structure in Pune. And they are positioned as a quaternary care hospital. So over the years, Sahyadri has been able to build huge clinical credentials and thereby the quaternary care positioning. So that's the journey of Sahyadri so far, this point of time.
And I'm sure, Panjam, that story helped you make that decision to invest in Sahyadri. But tell us a little more, what were the key factors that you considered when Everstone decided that Sahyadri is a perfect fit for you?
So, firstly, Sahyadri had a fantastic footprint, right? It was present in all the key micro catchments within the city of Pune, covering almost 15 million in population. Add to that, Nasik and Karad, you had a 20 million addressable market. Secondly, with sort of 700 beds standing and brownfield capacity to add another 500 odd beds, it was the largest play in the state of Maharashtra. I think third, it had a very strong clinical reputation. It was amongst the top 3 players in key specialities, had created a very well diversified specialty mix, and had very targeted investment in key doctors there. I think these were the key factors which got us to believe that this is the platform to build out a hospital ecosystem in the state of Maharashtra.
Okay, Kaivan, thanks for waiting by very patiently. The next question is to you, how do you think India as a country can become a stellar example for the global world to follow when it comes to providing quality, affordable and sustainable healthcare?
Sure, Ritu. I think, providing quality, affordable, sustainable healthcare globally is a rhetoric, right? But I think India can truly become a classical example of showing the world how it's to be done, right? And that's with the coming together of 3 things, political will, private sector enterprise, and public demand for accountable care, right? Insurance, and we've seen it through global evidence as well, is an essential but not a sufficient condition for universal healthcare. And we have a long drawn conviction that the real transformation in Indian healthcare is, Ritu's, contingent singularly on the success of scalable value healthcare delivery models in the country. Interestingly, as a country, we've entered this phase where we're going to see unprecedented opportunity in affordable mass healthcare offerings. Now, historically, we've not seen too many successful models. So I think when in 2018-19, we had the opportunity of partnering with Everstone, when they were executing their investment strategy of building a healthcare platform in West and North India with the focus on value segment, we were very, very excited. Right? And as we screened the market for suitable candidates, Sahyadri really emerged as a very prime candidate based on all that Pancham said, a formidable track record, visionary leadership in Dr. Apte, Mr. Bapat, and the diligence that we did, which really revealed that there was a strong potential for the chain to go forward.
All right, gentlemen, hold your thoughts. We have to take a very short break, but we'll be right back in just a moment. welcome back. You're watching the first episode of our special series, Transformation Realized, powered by Ernst & Young, and we're in conversation with you three gentlemen. Pancham, I'll come back to you on that note. What are some of the key changes and initiatives that have been implemented in Sahyadri Hospitals, keeping in mind the present as well as the long-term vision when it comes to building a seamless healthcare delivery ecosystem?
Firstly, all turnarounds need capital, right? And what we did was deployed a lot of capital to not only add bed capacity here, but also refurb their existing facilities. With Everstone's capital deployment, we've already added around 200 beds to the existing network that we had. And we have another 500 odd beds coming in over the next 3 to 4 years. Not only that, we also sort of refurb their existing facilities in a big way, upping the spec of the physical infrastructure to provide a better patient experience. But we also invested heavily behind medical technology to sort of provide better patient care. That was a big initiative that we ran through the pandemic. Second, and probably one of the most important, is the management changes. We brought in professional management. We brought in a new CEO in Abrar who worked under the guidance of the promoters to run the organization. We also filled in key positions in finance, medical director, diagnostics, digital as well. And we also hired EY who were doing the diligence for the asset for us. But we also got them to run a project management office for almost 2 years now, measuring and monitoring the different initiatives we were running. Third, I think Sahyadri already had a very strong clinical reputation, but we invested further to augment that, where we sort of wanted to build out a center of excellence focused on quaternary care. We invested heavily behind the oncology and transplant programs, both in medical equipment like Linacs across our units, in clinical teams. Today, Sahyadri can proudly say that it is probably the market leader in liver transplants and bone marrow transplants in the region. It is amongst the top 2 players in oncology in the region as well. We also sort of build out an independent diagnostic business, leveraging Sahyadri's infrastructure and brand equity to create a footprint of a diagnostic chain across Pune and in other parts of Maharashtra. We've run several cost-saving initiatives focused on power, consumables, pharmaceuticals, which is where EY came in, sort of helping us redo the pharmacy purchase, redo the consumable purchase, etc. We've taken several measures on the ESG front as well, where we added an oxygen plant within our facilities. We've augmented the life and fire safety measures drastically here. We've also sort of moved a lot of infrastructure to sort of augment the governance here. We've hired almost 1,000 plus people in the last 2 or 3 years. 55% of them is female workforce now.
Well, that sums up kind of, in a way, the huge transformation journey that has taken place at Sahyadri. But Abrar, I'm going to ask you this question. You said, of course, you brought in Abrar after Everstone came in. So you're the best person to answer this. What has been this transformation journey been like, apart from what we've heard from Pancham? Let's start with the growth story.
Firstly, as I said earlier, that Sahyadri is a hub and spoke model. And we had 8 hospitals, or we have 8 hospitals. The first step was to build up the infrastructure. So we went on expansion spree. We added beds. We added medical infrastructure to kind of strengthen the clinical capability of the hospital. After that, what happened is key hospitals, some of our key hospitals were positioned as quaternary care centers. When I say quaternary care centers, it means that these centers became, centers of excellences for liver transplants, all multi-organ transplants, for specialties called like neurosurgery, where we do a lot of complex neurosurgery, oncology, cardiac sciences. Because of the medical infrastructure that we strengthened, and a large part of the growth of Sahyadri came because we were able to get a lot of clinical talent on board. So the second step was to get a lot of doctors on board who kind of further bolstered the clinical image. We were competitively priced, so we we managed and we served all segments of the population.
Okay, that's quite an achievement there. Kaivan, I'll come to you next on that. What are the steps and strategies that are implemented to transform this digital capability and operating model that Sahyadri operates on?
What we're seeing fundamentally is the KPIs of the health system are changing towards three fundamental parameters, right? Cost of care, health outcome, and health consumerism, right? And a clear enabler of this changing imperative is technology, right? Which really has the potential to revolutionize speed and accuracy of treatment and diagnosis, enable remote care, remote monitoring, and more importantly, also enable shaping healthy behavior for prevention, right? So, be it genetics, be it molecular diagnostics, AI assisted care, telemedicine, wearables, health apps, all of that. So, I think that's point number one. Point number two, I think really technology in an area like medical science will really help in predicting the unpredictable, right? With the power of data, that can be really synthesized, collated, analyzed for sharper insights into advancement in products, services, and therapies. And finally, something I'm very passionate about, I think technology really will consolidate the voice of the consumer or the patient, right? And in some way change the power equation between the provider and the consumer.
Well, thanks, Kevan, for listing that out. But Abrar, what are your thoughts on the same?
First, we revamped our existing website. So we have revamped our websites. We've gone into bilingual websites for cities like Nasik and Karad. So that makes life simpler for the vernacular part of the population. We are on the way to get a new HMIS. So we've been working hard to create a tailor-made HMIS, and that HMIS or hospital management system is going to make it easier for us to kind of give more convenience to the patient. There are going to be doctor apps, there are going to be patient apps, which is just going to make the life of the patient and the doctor more simpler. So all this combined is or has made life for the doctor, the patient, the nurses, etc. very simple.
Truly adopting digital in every aspect of the business, so to speak. But hold your thoughts. We have to take another short break. Don't go anywhere. We're back in a moment. Welcome back to this special series, the first episode of Transformation Realized, powered by EY. Gentlemen, thanks for staying on. Abrar, I'll come back to you on how Sahyadri has really ensured it stays ahead of the competition and maintain at the same time the patient-first approach that you have.
So Ritu, we have launched something called the culture of caring. It's a culture. A good caring culture comes from happy employees, and that's what we're trying to imbibe into our organization. So we want happy employees. For example, we take care of them. In the pandemic, we took complete care of all the employees and even their families. So if anyone felt sick, we took care of them. If their families felt sick, we took care of them. So that's the culture we are trying to imbibe, make them happy. Culture of caring percolates right down to the patient, wherein our front office teams, our patient care teams are trained to take care of the patient. There are various sessions that we do, and we try to ensure that it comes out from their heart. So culture of caring is one initiative. For the patient, as I said, we have a call center. We have migrated to one number. So any patient who wants to reach out to Sahyadri has to simply dial one number, and all our services are available on that number. So that's another patient-first kind of approach where life is very easy for the patient to reach us.
Okay, while COVID presented a lot of challenges, especially for healthcare providers in the last 2 years, we've heard enough and more stories about how the frontline workers handled the whole situation. How did Sahyadri stay first among the healthcare providers to take these initiatives around providing provision for quality healthcare service to patients in Pune?
So firstly, we really followed whatever the government kind of requested or asked us to do. We were the first group to dedicate a COVID hospital. So we were the first private hospital in Pune to have a hospital which was dedicated completely to COVID beds. As I said, we took care of all our employees in terms of anyone who got COVID. So even if a nurse got COVID, not only did we take care of her, but we also took care of the family because in case the family got it. We did more than 2.5 lakh vaccination. We were the first group, Sahyadri, to start, or maybe probably the first private group to start COVID testing. And we did rampant COVID testing. So these were all the support that we gave during COVID.
Pancham, if you'd like to add to that as well.
We worked hard in preparing the organization for handling what was at that time not anticipated to be that long, but handling the entire disruption we were going through. Taking care of the employees at that point in time with whatever they needed, making sure their motivation levels are right up there to cater to the patients flowing into the hospitals at that point in time. And that needed a lot of support from Everstone, from the board, from the entire organization to make sure that the morale was up because they were at the front line. And, as philosophy, it was always a philosophy of care, of catering to all sections of the society. So Sahyadri was in fact the first hospital network to dedicate an entire hospital to Ayushman Bharat when it started. We had an entire hospital dedicated to it. We were the first ones to do that.
All right, Kevan, you have the final word. We've heard a lot about the partnership between Sahyadri and Everstone. What really is there for the industry to take away from this partnership and learn to improve the healthcare industry in India?
So I think some key takeaways from the Sahyadri program, I think when we did the diligence, I think it was very clear that Sahyadri had a very strong brand pull in and around the geographies that it operated in. Visionary leadership in Dr. Apte, Mr. Bapat, right? And a very sustained focus on delivering care at the right cost to the patient. And most importantly, a very deeply embedded culture of clinical excellence, right? And they were already better than most of the industry benchmarks when it came to performance. But what was there was a committed team focused on continuous improvement, hunger for excellence, and being the best. And I think that's where we all decided to really roll up our sleeves and get cracking. And that's where the partnership with Sahyadri, Everstone, and EY started in 2020, where we've been working with them through the investment lifecycle, right? By putting in place a very comprehensive transformation program, which entailed defining clear value creating objectives, establishing and implementing these initiatives and taking them towards fruition. And like I said, a very laser-like focus on execution excellence. Some of the aspects that we covered were the PMO. We stood shoulder to shoulder with them during the lockdown on the COVID management. We've helped them through clinical acquisitions, the Center of Excellence build-outs, the projects, the refurb. A very important piece has been working with them, and very important for the sector as a lesson is to really focus on the digital transformation piece with respect to really being intimate with all the stakeholders that are there in the healthcare ecosystem. I think summarily, it's been a very enriching journey for all of us, a very effective and synergistic collaboration between Everstone, Sahyadri, and EY, where I think the key lesson was really to be committed to achieving the best possible outcome against all possible odds and the kind of turbulence we've seen over the last 2.5 years. And very, very proud to say that, Sahyadri truly is now in the top percentile performer when it comes to all key operational metrics around revenue, around operational efficiency, around return of capital employed, and as well patient and clinical indicators.
Okay, so that right there, I think, is a big takeaway for the industry as to what happens when the right people, the right strategy, the right technology, all of it comes together. What a transformation journey it has been. Abrar, Pancham, and Kevan, thank you very much for taking time out and speaking to us here.
Absolutely, Ritu. Thanks very much for that. Unfortunately, that's it then on this edition of Transformation Realized, powered by EY. But remember, this is a 6-part series, so we will bring you more stories of transformation of companies that are realizing business ideas through the power of people, technology, and innovation. So stay tuned to CNBC TV 18.
Focus. Ideate. Innovate. Enable.